The COVID-19 pandemic, what we already know is that it's having a terrible impact on the state of Utah, folks, all up and down the Wasatch Front, with schools and universities closed and thousands of people either out of work or working from home. Now, the one bright spot that appears to be a byproduct of all of this is that there are fewer cars on the road, less traffic, and that has led to much cleaner air, at least what it appears to be much cleaner air, but even that is somewhat of an optical illusion, because even on a clear day like today, we still have unhealthy levels of PM 2.5 pollution. And we know during times of inversion, the air is even worse, much worse. Now, a new study by the Harvard School of Medicine shows chronic air pollution is yet another underlying factor, along with diabetes, heart and lung disease, and a compromised immune system, which leads to increased mortality rates for those who do wind up contracting the coronavirus. Dr. Brian Mensch, the president of Utah Physicians for a Healthy Environment, says he hates to be a downer on such a beautiful day like today, but he adds this is yet another potentially deadly byproduct of our bad air.
It's really unfortunate that we can't enjoy this wonderful spring weather and blossoms coming out and have to think about very serious issues like this. But ignorance shouldn't be bliss. We should understand what kind of risks we're facing, and unfortunately this study highlights a brand new approach to how serious a problem our air pollution is.
Now, this study examined the vast majority of the U.S. population and focused in on the effects of air pollution on those who wound up passing away from the coronavirus. This is a pretty detailed study. It's not super long, but it's got some pretty interesting elements to it. And we've got the whole thing for you to read on our website, fox13now.com. For now, we're live in Salt Lake City. Scott McCain, Fox 13 News, Utah.